welcome our final speaker, Dr. David Okello. Dr. David Okello is a Kenyan mental health researcher specializing in the uptake of AI and alternative therapies for mental health care. Since 2020, he has worked on innovative projects targeting underserved communities. His work integrates AI-powered mental health screening and alternative therapies such as music therapy, creative arts, and community-centered solutions. He leads the 52-week Music and Mental Health series and actively collaborates with Healthy Minds Africa Collective Initiative to foster sustainable mental health practices across Africa. Please join me in welcoming Dr. David Okello. Would you like to share your screen? Oh, there it is. Perfect.
Are you able to see my screen?
Yes.
All right. Thank you so much. When I was asked to speak here today, I wasn't so sure what I want to talk about because I was asked to talk about my work, but I've been working on so many things and I didn't know how to put them all together. So I said, let me start from the beginning. So Healthy Minds Africa Collective Initiative. This is the work group behind Thalia Psychotherapy. Thalia Psychotherapy, where we integrate artificial intelligence into mental health. One of the greatest achievements we've had so far is making mental health a conversation that is being normalized. Before, conversations around mental health have been stigmatized and cultures have not been accepting. And we've been looking for solutions that people are able to relate with, that will also not scare them, because mental health in itself is scary to them. So at Healthy Minds, instead of exploring tablets and injections, we are looking at alternative therapies through music, through arts, and other culturally relevant materials. So starting from the beginning, I'll be discussing the uptake of artificial intelligence and alternative therapies in the counties that we have worked in Kenya. And we do understand and we do acknowledge that mental health is underfunded. And we also do understand that there are lots of gaps. However, we also do understand that African governments might not increase funding for mental health care miraculously overnight. So a country like Kenya, where the patient-doctor ratio for mental health is 1 to 500,000, the Ministry of Health reporting that we only have about 100 psychiatrists, and the population is over 47 million and rising. And those in rural areas and the underserved areas are bearing the highest burden because the few doctors will run to the urban area. And when they all go to the urban area, the rural areas are always left without care. So we are introducing research in mental health that drives us solutions to bridge this gap. And that is where we are driving AI solutions. And with the introduction of artificial intelligence, persons are able to access mental health care right from their phone. without having to queue waiting for a mental health specialist. And our aim is to improve mental health services across Africa. So now the objective of this study, the primary objective was to improve mental health access in underserved communities. And this is a work that is still in progress, and we are examining the effectiveness of artificial intelligence, and we're also exploring the role of alternative therapies, and we're also measuring the uptake and engagement of AI-driven mental health tools. And the methodology, we have a mixed method approach where we are combining both quantitative data that is from the app and the therapy participants, and we are also comparing it with qualitative insights from the literature that we've reviewed and the user feedback. The tools that we are using, we have an AI-powered tool, it is called Mindful Kenya, that is able to provide screening for mental health. And we also have an AI-powered voice tool that one is able to get a diagnosis by simply talking. Then we also have a qualitative data collection tool. And our therapies, we have the traditional therapy where they have the hospital-based face-to-face, then the virtual therapy that is through the phone. Then we also have the music therapy, creative therapy, and culinary therapy that are also offered in person. So reviewing data from about 400,000 participants and looking at the users who have used the platform from the about 1.7 million screenings, and even those who paid for the service after the screening, about 400,000. Majority are in the city areas, but the rural areas is still low. However, it is not zero. That means there is improvement, and that means there is hope that digital tools, with a little support, digital tools can also make great change within the rural areas. Then looking at the distribution by age, the youth are most likely to use the digital tools, and the males are also most likely to use the tools than the females. Now, I could argue that the male youth has always been under pressure and is mostly ignored because of culture, and that would make the boy child hide away and will not want to speak. But when you bring anonymous screening tools, you find they're able to open up and they're able to speak openly without the fear of being exposed and judged. However, again, in Africa, access to digital technology for the females is lower compared to the males. So maybe the females, fewer females have access to technology devices compared to the males. So with Africa, access to data is still tricky, and we are doing this still at a small scale. However, as we get more data, we'll be able to get a clearer picture. The AI solution has increased access for about 60% of persons, and they have reported improved well-being for when they're able to talk about their condition. And when they see it is something that has been recognized and that nobody's telling them it is stupid, it is you being petty, no, you need to man up. Somebody is able to tell them that it is okay not to be okay and that it will get better. They're able to improve their mental well-being, they're able to improve their mood, and they're able to reduce anxiety among themselves. And those who had bipolar disorders where the emotions run extreme, you find that when they're able to speak out, then they are able to manage their crisis without having to run into. And there is a lot of interest in virtual therapy. However, there is also a lot of interest in alternative therapies. Traditional therapy is low, and that is okay because most of those who opted for traditional therapies were in the city areas like Nairobi, where there are more hospitals, so they are able to access facilities compared to the rural areas where most of the time hospitals are far. And with the rural areas, there is that tradition is so strong, and tradition around mental health makes it difficult for most persons to take up traditional therapies and would rather get alternative therapies. Now, in reviewing the impact of alternative therapies, respondents are able to appreciate that indeed there is an effect. It does affect their emotions, and they're able to manage stress and anxiety and improve their relationships. And one thing that I did find most interesting was with the music therapy. I personally have a bias towards music therapy. Do have a passion for music, and running my 52-week on music therapy to try and raise awareness on music as a tool that can be used in managing mental health in a country like Kenya and Africa at large, where cost of mental health is high, and music can come out as a tool that is low cost and can actually manage the situation. We were teaching, from this we were teaching persons within the community on music therapy, and we were teaching them meditation. And out of the 100% participants, all the 100% participants practiced meditation in private after the training, and 20% of those who practiced in private continued to practice meditation openly. And they were so happy about the results, and they appreciated the ability to manage and to regulate their emotions. Then we had 27% who continued, but they did it secretly because of the many questions that they were being asked by those around them, family and friends. What kind of music are you listening to? When they're asked, what kind of music are you into? Telling somebody meditation music, for most of them, families associated it with the devil worship. And though they do see the benefits of the music therapy, they're just not comfortable practicing it in public because they have people to deal with. Now, I have these 53% who discontinued, and the interesting part is they did not discontinue because they did not like it. They discontinued mostly because of the internet or smartphone, or they could not manage the pressure from community on why are you listening to this. There's that stigma around mental health. Then there will also now be stigma around this kind of meditation music, associating it with devil worship. It makes it hard. It made it hard for the 53% to continue. However, music therapy has been proven to actually be a solution for most mental health conditions, and this is something that this is a solution that we are key to explore as Healthy Minds. And from the work we've realized that the AI-based screening does make service accessible. Most of the tools that are used in psychiatry are able to, can be digitalized. And when you put AI in it, then somebody is able to get that hospital-like experience. So instead of waiting for the psychiatrist to have to ask you the questions one by one, you're able to actually take the tests on your own, and you're able to get your path through the treatment. You also realize the alternative therapies and their impact in emotional well-being, considering that with Africa, talking about mental health in itself gets people scared. And so when you want them to do something about it, other than just talking about it, requires a lot more energy. And AI voice tools are also very important, and they really provide key insights. When somebody is talking to you anonymously over the phone, as they say hello, by just saying hello, you're able to pick depression, you're able to pick anxiety, and that will guide how you speak with that person going forward. Then you also found that the binaural beats, the music, if we can integrate that music into cultural songs that people are used to, that they know, so that we don't bring to them two new things at the same time. You bring them AI is new, then you bring them these binaural beats new, so that might scare them. So we are recommending that scaling these AI solutions and alternative therapies into the public healthcare system, and also expanding research on impact of music and the impact of alternative therapies, so that we can influence policy. And when influencing policy, we want to advocate for the formal adoption of alternative therapies and artificial intelligence tools into the public healthcare system, and in pushing for universal health coverage, because at the moment in Kenya, mental health care is only accessible from level 4 hospitals. That means level 1 to 3, you do not have mental health services. And from that level 4 hospital, it is also not available to all. Costs do apply. And in the spirit of universal health coverage, we must make sure that services are accessible to all, whether they can pay or cannot pay for it. So our next steps is in expanding our study on music and mental health. And we are looking at expanding to 10,000 participants, and we are looking at persons from marginalized groups. And the primary objective is to assess impact of music therapy on mental health and social behavior change, so that we can answer 3 questions, which is how does music therapy using binaural beats affect emotional regulation and stress management among marginalized groups? A second question will be the impact of music therapy on stigma and social interaction within these populations. And number 3, can music therapy be integrated into public health frameworks to serve the larger population? So we are collaborating for impact on this, and to make music and mental health one in Africa, we will need experts, and some of these experts might not be available locally, like music therapists and neuroscientists, so that we are able to refine the intervention, and the neuroscientist is able to validate the neurological impact of music on mental health. Data scientists and also persons who will help us localize and culturally adapt the therapy solutions. We're also working with community health workers, and we're also working with IT professionals, though they are all unpaid. And the IT professionals are coding these programs so that at the moment, our mental health solution, the Mindful Kenya, the screening app only provides the virtually screening and the virtual psychotherapy and booking, online booking of the doctors and therapists for the traditional therapy. But we want to now bring in this music therapy as also part of the solution. And we are getting, we have IT professionals from the community who are helping us code this thing, but we also have community health promoters who we are trying to teach about music and mental health and meditation music so that they can start creating awareness about it. So when we launch this thing, people do not see it as, hey, now what is that? And we also, after the development is complete, we will want to test that product and co-develop with marginalized communities. We are targeting the marginalized communities because if it works for the marginalized communities, then it will work for the rest of the population because marginalized communities have a higher burden of mental health. And if it can work for them, then it will work for the rest of the community. We are currently bootstrapping the solution, and we are developing a business model through Health Tech Hub Africa. We want this, when the solution is rolled out, it is not rolled out as a solution that will constantly depend on donor funding. We want a solution that when it goes out, everybody is able to access it. And we are exploring other solutions besides just a cash-based system. We are also exploring insurance so that insurance system can also see the value of music in mental health and in decreasing the claims and cost of healthcare. Thank you so much.
Thank you so much, Dr. Okello. Thank you, thank you, thank you. Alternative therapies are incredibly important and impactful, and I know music and mindfulness can be both so healing. So thank you for your groundbreaking work that you're doing, and I look forward to following your journey and see how much more of an impact you're going to continue to make. So thank you. I'm going to
Thank
hold
you so
off on
much.